My name's Pete Woods, you're watching Excellent TV. Who are you?
Hi, my name is Birju Bartoli. I am the Chief Executive of Northumbria Healthcare Trust.
So Birju, tell me a little bit about your background.
Yeah. So I am, I was appointed Chief Executive of Northumbria in 2024. I started in January 2024, but I had prior to that worked in the organisation for 21 years. So a well and truly seasoned Northumbrian, I would say. This NHS management was my second career. My first career, I'm a scientist by background, so I had done a lot of research in university, so both at PhD and postdoc level, and then had a moment whereby I decided I wanted something a bit more from life, and that was the NHS, and now I'm completely wedded and sold to the ethos of the NHS. Probably that's going to be my last career choice, I should say. I won't be changing again.
So you've been the Chief Executive of Northumbria Healthcare NHS Trust for about a year.
Yeah.
How have you found it?
If I say it's been a bit of a roller coaster in terms of I have loved it, I've spent time worrying about things that perhaps was partly because I'm new to the job and I would become more accustomed to it at a later date. If I had to say it in a word, I've loved every minute of it. It's not easy, and I think that's the balance of when you really enjoy what you're doing but know it comes with highs and lows. I would say that probably the fact that I work with such a fantastic team, and that's the immediate exec team, that's the board, but it's everybody that works in Northumbria. I'm sure everybody would say this, but I truly believe we have got something special here. Our staff are fabulous, and what they tell us, what they need, how engaged they are in terms of not only what we deliver for our patients and our local communities, but what they do for each other is really, really quite palpable within the organisation and can be very humbling. So particularly at times of stress in the system, going above and beyond is just, I couldn't recount on here what they do for each other, and that's truly fabulous. I think we've had some really tricky times, so winter has been really, really difficult. It's been difficult both from an acuity point of view of the types of patients that have been coming to use our service. There's been a lot of flu around, that's put a lot of pressure on, but also from a staffing point of view, because they've had to go above and beyond as we've expanded into additional ward spaces, environment spaces to look after patients. And yes, they get tired, but actually they still keep that smile on their face, which is truly quite humbling.
What are the challenges for you and for the trust going forward, Birju?
Yeah, I think we are moving within the NHS into a position where money will get very tight. We've seen that in all the government announcements that have taken place recently. So we're going into an era that is, I think, will be tight on money, but still a lot of ask from the national perspective. Changing models of care, you hear a lot about the NHS needs to transform, balancing that at the same time of having to save money. So I think that is a challenge. I think the other challenge is, but I always see it as a bit of an opportunity, is really how do we tip our model of care on its head? So we've seen, particularly through this winter, our frail elderly patients, the numbers have increased quite significantly from, if you compare December 23 to December 24. And that you could say flu fluctuates up and down, but that frail elderly group, that's not going to fluctuate, that's just going to increase. And I think we need to really take stock of what our clinical model for the future will be. And that will align itself, I think, to the 3 shifts that nationally they've talked about. We've always, as an organisation, we've been fortunate, we're an acute and community combined integrated organisation, how we want to move care more out into our communities. But I think we have to be very clear what we mean by that and who else we need to help us around us in our system that will help us do that. So that is local authority colleagues, primary care GPs, And again, fortunately, we do have good relationships with them. So I'm of a belief if anyone can do this, it's us up here in the Northeast, just because those relationships are so well founded. So I think they're the challenges that we have to get to grips with. But as always with these things, there's an opportunity in doing that. So I get people look at me in a bit of a strange way, because I say, but this is exciting, there's a problem to solve here. If anyone can solve it, we can, we just haven't got it right now. But between us, knocking ideas around with our clinical teams, with our partners, I reckon we'll get to the right place.
So we've got a fairly new government in power at the moment. How are their new priorities affecting the way that you operate within the trust?
Yeah, so the things that I've just talked about there in terms of our shift of clinical model, we had already, I would say, started on that journey. So we had a significant digital investment. Probably we're talking at least nearly 6-7 years ago now. We were affected as an organisation by WannaCry back in 2017 quite badly. And at that point, the board made a decision that we had invested in clinical services, but we'd never really truly invested in our digital services. And we have subsequently every year put a significant amount of investment into digital and have completely revolutionised how we work now. So we've moved away from the old traditional big file paper records. It's all digital record now. Lots of digital systems that we've got in place. What we haven't fully shifted to yet is that digital in the community. So you hear about sometimes, I heard recently, a hospital in a bag, which might mean a patient when they're discharged gets given a blood pressure monitor, a temperature thermometer, etc. to take home with them so that they can upload particular observations to clinical teams who might be in the hospital. So I think that our next bit, digitally, we've got a very good foundation to start to build on. We need to now build on that allows patients to take some of that into the community, which is one of the shifts the government has talked about, to allow them to feel safe and comfortable at home, and for our clinical teams to feel comfortable that they can keep an eye on them and make sure they remain well. We've also within the organisation got a public health team. So traditionally public health is managed by local authority. Again, we work in partnership with them, but we do have a small team within the hospital that actually looks at how the prevention side of the things we do. And they're very integrated as well into all of our core services that we deliver to try and pick out areas of impact that they can have to prevent people coming into hospital unnecessarily and or change some of their lifestyles that also will allow for that in the future.
One of the big things at the moment is access to mental health services. Health is not just physical health, it's mental health, and lots of people are walking around with perhaps issues with mental health which aren't obvious.
Yeah.
How is the Trust responding to the need within the community for mental health services?
So I think you're right, that's an absolute challenge for us. We have seen a significant increase in terms of the presentations to our emergency department with people suffering from mental health in its broadest in the broadest sense. And some of it, they absolutely need hospital services. We have a psychiatric liaison team that works into our emergency department who can assess and redirect patients accordingly for the presentations that they might come to our hospitals for. There is a lot of work we do with CNTW, which is our specialist mental health provider, again, both in terms of old age psychiatry and child and adolescent mental health as well. Again, two areas where we've seen that increase in attendance. We work with them to try and work out where our boundaries might lie. So we physically look after the physical health element, but understand there's a mental health element, but we need to work with partners because we're not the experts in that. So how we make that transition as seamless as possible. I think from a general overall well-being point of view, there are things that perhaps people could do to help support their own mental health. So that regular exercise, that regular sleep, that looking out for other people. So whilst it's not a hospital presentation, but actually just making sure that you keep an eye on your own well-being and your own health and your own resilience and the things that you can do to support that. We try and promote internally within the organisation. So we have a staff wellbeing hub. It's a link on our intranet page, and we've got a number of wellbeing sites as well across our organisation, and encourage our staff to seek that support from those areas to help them as well, because they can take that home to their own families as well.
So we're here at Hexham Hospital. I know that the theatres are being renovated at the moment. Tell me why that was necessary and what the theatres will be like when they've been renovated and the sort of timescale we're talking about there.
So you know that Hexham has undergone quite a transformation. It's been a significant investment, over £15 million already, to revamp our oncology day unit, a women's health service. We've now got a dental suite up here as well. The theatres element, I think, is the last part of the big refurbs that we need to do. It moves all of our theatres to have laminar flow, so particularly means there's flexibility between the theatres. So orthopaedics, joint replacements, they need to be done under a laminar flow environment. By having all four of them in that way, it just allows for some flexibility about how we can and where we can and when we can operate. I think that the age of the work needed to be done from an age point of view as well of our theatres. So it all came in quite a timely way to say, well, we need to renovate and make sure our air handling units, etc., are up to scratch. Actually, if we're going to do that work, if we stand back and say, what would we want our theatres to be? We should just do all of that in one go. It's been, I wouldn't want to say it's been straightforward, because clearly we haven't wanted to stop any of the activity that we were doing on the Hexham side. We wanted to keep making sure we could deliver that. So that has been challenging for the teams, and they've done a phenomenal job in terms of trying to make sure that our patients don't suffer as a consequence of the theatres being closed here. So we've used really to maximum capacity all of our other theatres that we've got across the hospital, and the staff have been great in terms of appreciating that it's a disruption currently for them, and we fully understand that. But we will be back in a brand new facility, hopefully by the end of the year. We're really looking forward to that, because this comes along the same time as the government plan to reduce elective waiting lists. And we are one of the organisations, there's about 20 of us, that have said there's a 4-year window in order to return to that 18-week referral to treatment standard. And we're one of the organisations that have said we will try and do that within 2 years. In order to do that, we absolutely need to have all of our theatres up and running. So we're crossing everything that there's not a hiccup anywhere along the way, because we would really like to have those theatres up and running and open so that we can really plough on with our operative work. And it's not just the operative work that we need to do. We obviously need to do outpatients diagnostics, but we've got that full suite here. I think there is something very special about Hexham Hospital. There's something special about all of our sites, I should say, but Hexham is unique in terms of being able to not only look after inpatients, but also have that theatre capacity and flexibility. And that is because of its location, can take people from further out west, as well as Newcastle, as well as Northumberland, North Tyneside as well. And it's such a lovely facility, and people don't mind travelling to here if it means that they can get their operation done in a timely way.
Now, lots of the services that is provided at Hexham are via the outpatients department. Is there any plans to refurbish the outpatients?
So we've done that classic thing where we've changed one bit and now that's nice and new, and then the next bit goes. So I've already been collared by some of the wards to say, well, now that looks really nice. Can you do this? So I suspect that we'll end up doing everything eventually. I think there's a timing thing for it. I think what the builders have done very well is when you walk onto some of the new units, you can't, other than the fact that they look great and you know what they looked like before, they've managed to mirror with existing doors, existing colours, existing walls, so you can't quite tell that it's new other than the fact that you know it's new. And I think that will be important, so it doesn't look like, the blue corridor stops and then there's another white corridor and that's where the changes took place. We will look to do each bit at a time. Outpatients is a key part of our activity. We have a lot of footfall that comes through. We always try and ensure that we've got local services for local people, so there's always a stream of activity here. We obviously picked theatres, the oncology day, the dental suite, for a reason that needed to be done at the time, and that's where our pressures sat. I think it will be a part of an ongoing programme because we've got other sites that we also have to do in our communities, so particularly Blythe and Alnwick are also two areas that need to have some refurbishment undertaken.
One of the things that is of concern by some local people is because of the rural nature of this part of the world, that if there's an emergency, the ambulance won't necessarily come here. It will have quite a long journey with some quite serious patients to Cramlington or the RVI, which I appreciate is in a different trust, but sometimes they go there. And also for visitors, if someone's an inpatient, there's a very long way, particularly if you have to travel by public transport to get to go and visit someone who's in hospital. Is there anything that could be done or might be being thought about that might improve that or help people in those circumstances?
Yeah, it's quite it's always a fine balance, isn't it? So the ambulance service in an emergency will take you to the nearest hospital, regardless of whether you're known to Northumbria already or whether you're known to Newcastle. Wherever you might be, they will always take you to the nearest hospital. I think that for our model in particular, we have tried to say, if you're to the ambulance service, if you're known to us, you've got a long-term condition, you're under our care already, be it in an outpatient, an elective manner, please come to us because we know your history, we know what treatments we've given you, we can see your full record, and that if the journey might be slightly longer, as long as it's safe to do, bring to us. That doesn't always work, unfortunately, and you can understand that. The ambulance service, the paramedics just deal with what they're seeing in front of them, and if they think it's an emergency, life-threatening, they'll just take you to the nearest emergency department. What we've always tried to do is, if you come to us, and actually even if you go to end up in Newcastle, we've got now more robust arrangements to get you back to Hexham as quickly as possible. So if I talk about the Newcastle, only because I'm familiar with the setup that's recently been put in place, if you go to their emergency department, if you live out west, you're more likely to end and have an incident out in the west, you're more likely to go to the RVI. If they decide to admit you, you move from the emergency department to their admissions ward, and what we'll try and say is don't move them on from that admissions ward into a specialty ward, we'll take them back to Hexham, so we bring you back at the earliest opportunity. And then similarly, if you do end up at Cramlington, we would do the same, and we do that for those residents that might be nearer to Wansbeck or those residents that might be nearer to North Tyneside as well, realising that it's not just the patient, but it's their visitors and relatives, etc., that would like to see them. We did try, this is a good few years back, trying to put a taxi service on, a bit of a shuttle service. It wasn't really well utilised, And as a consequence, I don't think that's really ever taken off, and we tried that for all of our sites, and it's never really been something that we've been able to get to work. But we will always try as well and be accommodating for those that might have difficulty getting to see relatives. How can we help support to get them to Cramlington, or I'm sure it would be the same for the RVI, but really making sure that the patient gets back to Hexham as soon as possible.
Now, staff are vitally important to an organisation like the NHS and a trust like Northumbria. Tell me a little bit about what you're doing to bring on perhaps the new cohort of staff, as traditionally, you know, people will be leaving all the time. They've reached
you wanted to say
age.
The younger generation, didn't you? That's okay. So staff are really important to us, and their development is also really important to us. So we recently opened our Health and Care Academy, which is based at Cramlington, and that very much works closely with local colleges and also the university. So we've got good links both with Northumbria University but Sunderland University as well. We have a nurse apprenticeship, nursing associate courses. We have a number of apprenticeships that we run for both school age but also that slightly mature person who might want to do further education slightly later on in life. And we've seen huge benefits, particularly from the apprenticeship schemes for us. So we have taken a large number of people both from into a clinical but also some of our non-clinical areas where people wouldn't necessarily have known. They sometimes think the NHS is nurses, doctors, maybe a physiotherapist, and that's it. But we've been able to open the eyes to say there's a lot more to the NHS. So we've got some engineering apprentices as well, male and female, which is really good to see. We've also got a widening participation team that go out particularly to schools and colleges to say these are the jobs that are open to you, these are the entry points as well, which is important. And then I think as well, it's not just for our new recruits. I'm a firm believer in education, so if we can help anybody by helping them with their education whilst working with us to then subsequently further their career as a consequence, we want to do that. I think it can offer a whole host of new opportunities, and whilst we would never want anybody to leave us, actually, do you know what, if they can get a better job somewhere else as a consequence of something that we've helped them to do, then I think that's absolutely the right thing. So a firm believer in anybody who wants to have that personal development, wants to further their own education, and we would look to support that, and we do that by a number of degree apprenticeships, etc., that we provide for staff.
How can local people help the trust and help the staff here at the hospital and across the trust themselves, you know, perhaps by preventing themselves coming into hospital in the first place?
Yeah, I would say to look after yourself, look after your health, and that's even not just when you're feeling unwell. Clearly there's lots of home remedies, etc. I don't just mean that, I mean your own health and well-being, physical and mental well-being. You know, the classic of get some fresh air. You don't have to be a gym goer, but actually just going for a walk every night, half an hour, the fresh air, getting good sleep and getting some good nutrition, if you can, as well, are all things that you can do to whatever age you are as well. I have elderly family members, I'm going to sound very strict here, who even when it's cold outside, oh no, we can't possibly go for a walk. No, you need to go for a walk. The fresh air is good for you, the exercise is good for you. So I would be saying there's lots that we can do as individuals, but also encourage our family and friends, go out with them. And sometimes it might not be a brisk walk, but it might be a gentle walk to a coffee shop with somebody who you don't see very often, that just gives them a bit of social interaction where things such as loneliness can mean a lot for people who might be at home by themselves for long periods of time without seeing anybody. So that one gentle walk to a coffee shop might make all the difference to them. I think that is really important, particularly when it's dark outside and people don't necessarily get out and want to go out very much. So there's that self-help in terms of looking after yourself, your neighbours, looking out for people that you haven't seen out and about for a while in your own town, street. And then I think there is the element of when you are feeling unwell, how much can you do to self-care? Rather than just necessarily going straight to the GP or straight to the hospital. Particularly at times of pressures, there's a lot of, I'm going to just say, things that are in the air when you might be sitting in an emergency department that you don't want to be exposed to necessarily. So anything that you can do to look after yourself and your own health, is a good thing.
When you've got a few years under your belt here as the Chief Exec, what will success look like?
Oh, that's a good question. Success for me is Northumbria being still excellent in all of its patient and staff, I'm going to say, metrics. The reason I think we all come to work is to serve our communities and the patients that come and use our services. For me, feeling really confident that actually what we deliver to our communities is the best. So people always say, well, how do you know when you've got the best? Actually, I want to know that when I'm walking down the street and my neighbour comes to me and says, oh, I was at your hospital and it was fantastic, I had a great experience. We know that there is always areas for improvement in whatever we do. So our core metrics might all say we're wonderful, but we always know there's still more to go at. I want to feel that Northumbria is always giving its best, which I think it does. We always strive to do more, strive to be better. We always want to improve. And success for Northumbria is continuing on that journey and not sitting back and thinking, we've done it, we don't need to worry anymore. We will always be, and what next? What can we do next? And how can we improve this further? I think fortunate, and I am one of these people where Northumbria is my local hospital. It means an awful lot to me because of that. I've used its services, my family have used its services, and I want the experience that I've had of using the services to be, they've been fantastic, but I want everybody then therefore to have that same experience, and we need to see how we get that every time, manage to get that right every time.
Well, a bit of feedback from me. My family have used the services in Northumbria, both here in Hexham and at Cramlington, and the service has always been exemplary, and both all parts of the organisation have really been caring and professional in their approach. And just on behalf of local people, of which I am an example, I would like to thank you and your staff for the services that you give to our community, because it really makes a difference to have a hospital and a trust that are so focused on their communities and so focused on sort of improving and making sure that they get things right. No one can get everything right, and we all appreciate that, but from my own experience it's been fantastic, so thank you very much.
Thank you, and I'll definitely pass that on to the staff.
I'm going to ask you one final question.
Okay.
What is it that excites you looking forward? If there was one thing that really excites you about changes in the health service, what would you say?
I think it's that opportunity to completely shift our model of care and make that big leap into the next. We'll have to be brave to do it, but being able to make that next big leap for us as an organisation in terms of what our clinical model will be for the future. I think we know a lot of the evidence in terms of the the population that we're going to have to serve moving forward, and actually how do we shift our model enough to do that. I'm quite excited by that because we haven't got the answer yet, which is the good bit, because that's the bit where we need to have the brains of the clinical teams really coming forward, and that's the exciting bit, I think, trying to shape some of that with our local communities, because we might think it needs to be one thing. We then need to test that out with our local communities and our partners to say whether that is the right way to move. But I think I'm always half full, if you might have realised, and that's the bit I get very energised by. So I get energised by looking at where are the improvements and why can we not do something. We need to be able to do it. What's our next big thing? So for me, our next big part of our clinical strategy, we've changed some of our front door elements, is very much around our frail elderly, and how do we wrap our arms around this group of patients to really look after them in a slightly different way to what we're doing now. I'll come back to you once we've worked it out. It'd be great to come back to you and share that with you.
We'd love to hear that. Birju, thank you very much for talking to Hexham TV.
Thank you.